This is NNI Bites Big Learnings, a podcast where fellow healthcare professionals converse about the latest on nutrition science. Join us as Hania Shayevska and Rodrigo Vazquez share their knowledge and insights on gut microbiota and disorders of gut-brain interaction.
Hello and welcome to today's special episodes of the Nestlé Nutrition Institute podcast, NNI Bites Big Learnings. I am your host for today. I'm Hania Shayevska, professor and chair of the Department of Pediatrics at the Medical University of Warsaw, Poland. And today we will be discussing gut microbiota and disorders of gut-brain interaction. The gut-brain axis is a bidirectional communication system between the gastrointestinal tract and the brain, with gut microbiota playing a crucial role in this interaction. And today we have a very special guest, Professor Rodrigo Vazquez from Universidad Nacional Autónoma de Mexico, who is a pediatric gastroenterologist and nutritionist, and he is a president of the Latin American Society of Pediatric Gastroenterology and Nutrition, who will share with us his expertise on this topic. Hello, Rodrigo. It's really nice to have you here with us. Could you please introduce yourself to our listeners, and could you please tell us what inspired you to specialize in this field?
Thank you very much, Hania. It's a pleasure for me to be with you. Well, my name is Rodrigo Vazquez Frias. I am a pediatric gastroenterologist and nutritionist from Mexico. I work at a third level hospital in Mexico City, and PhD in medicine from Universidad Nacional Autónoma de Mexico, or Mexican National University. As you mentioned, I'm the president of the LASPGAN, and I'm really passionate about the microbiota and gut-brain disorders.
Excellent. It's good. And my first question to you, can you please explain to our listeners what is this gut-brain interaction disorders and how they differ from what we used to call functional gastrointestinal disorders? Because previously this was a term that we were using, and now we are not supposed to use it. So please explain it to us. Gut-brain interaction disorders. What does it mean?
Yes, that fancy name about gut-brain interaction disorders, commonly known as functionally gastrointestinal disorders, are the most common diagnosis in gastroenterology and also in pediatric gastroenterology, and are recognized by morphologic and physiological abnormalities that can occur in combination, including motility disturbance, visceral hypersensitivity, altered mucosal and immune function, and also altered gut microbiota. Nowadays, we do not use the term functional because we don't have to normalize this kind of disorders. They are expected to occur, but are not normal. So we have to stop normalizing the presence of these disorders. So we encourage all our colleagues to use the term disorders of gut-brain interaction.
Okay, and we are waiting now for the Rome 5 criteria, because previously we were using Rome 4 criteria for the diagnosis of those disorders. Now we are waiting for Rome 5 criteria. I think they should be published in 2025, hopefully. So while the exact mechanisms of how gut microbes influence the brain and vice versa are still being uncovered, scientists have identified three main pathways, I think you agree with me, through which the gut microbiota affects the gut-brain axis. This is a direct neural signaling via the vagus nerve, extremely important way, hormones circulating in the blood, and last but not least, the neurotransmitters and neuroactive mediators produced by the gut microbiota, and also by immune cells through cytokine secretion. So can you explain to the listeners what role there is for gut microbiota? What role does gut microbiota play in this gut-brain axis?
Yes, We have to remember that there are a lot of evidence that gut microbiota has a significant role in gut development, maturation, and immune system differentiation. So there has been accumulating evidence that the gut microbiota and its metabolites also regulate various aspects of neurodevelopment and cognitive functioning throughout the life. So the gut microbiota can produce a plethora of metabolites such as short-chain fatty acids, tryptophan metabolites, and biliary acids. The microbiota exerts regulatory control over the neuroendocrine hypothalamic pituitary axis. So the network of neural signals, immune signals, and chemical signals constitutes a major part of the microbiota gut-brain axis. Nowadays, we know that change in the gut microbiota composition and microbiota-derived short-chain fat acids, the amino acids or metabolites can alter neural, immune, and chemical signals. So this is the way that gut microbiota interact with the neural system in the gut barrier and then to the central nervous system.
So, Rodrigo, based on what you are saying, it's not only important who is there when it comes to gut microbiota, but also what this gut microbiota is doing, so functionality. Do you agree with that?
Yes, of course. Maybe it's more important or more relevant to know what the microbes, not only the bacteria, the fungi, the virus, are doing and are secreting to our body.
And can we say about our gut microbiota is kind of like a biochemical factory, I would say, in one way or another. As you said, there are so many mediators which are important for the function of gut microbiota. But I have another question to you, Rodrigo. What are some disorders associated with gut-brain interaction, and how do these disorders manifest in patients, and especially in pediatric patients, because both of us are pediatricians?
As you may know, and nowadays we have all the diseases are associated with microbiota, but not all the diseases or all the conditions have a relationship of causality.
It's very important what you are saying, that we are talking about associations, but hardly ever we are talking about causation, which still has to be documented if it's possible at all, because it might be that it's just not possible to document it.
But there are a plethora of disorders and diseases associated with the microbiota gut-brain axis, like infant colic, irritable bowel syndrome, functional pain disorders, but also has been associated with depression, autism, anxiety, schizophrenia, Parkinson's disease, and Alzheimer's disease. So in infant population, the best example who fits with this model of alteration of gut-brain disorder is infant colic.
We'll discuss it later on, infant colic, because I think it's important. But again, I think it's important to underline that we are just speaking about associations, as we already said several times. Most research on the gut microbiota roles in the gut-brain axis has focused on bacteria, but you already mentioned that it's not only bacteria, but also other microorganisms, viruses, fungi, etc., that has been, I think, for quite a long time overlooked. And what do we know about the role of those other microorganisms, like, for example, gut fungi, in this communication between the gut and the brain? Can you elaborate a little bit about that?
Yes. We need to recognize that most of the evidence about microbiota are from bacteria. More than 90% of published is about bacteria, but we need to remember that gut microbiota are constituted by virus, by fungi, by parasites, and we have to remember that fungi are ubiquitous microbes existing in different environments and are indispensable members of human intestinal ecosystem. Commensal fungi are much less studied than bacteria, as fungi constitute a tiny fraction of the symbiotic microbes in humans, and most of them are unculturable. So it's difficult to study maybe, but these intestinal fungi have important effects on maintaining gut homeostasis, just as bacterial species. We can call them as a gut microbiome. And this gut microbiome is involved in the existing mechanism, by example, of irritable bowel syndrome, including low-grade inflammation, intestinal dysbiosis, visceral hypersensitivity, and brain-gut interactions. By example, tight interactions between fungi and bacteria are observed in the intestinal microecosystem. So fluctuations of either the two species will lead to intestinal dysbiosis. So we need to go forward about the interactions of these microorganisms. They are no separate. They are interacting all the time.
And we are not discussing viruses here, which is, of course, another player in this game. Rodrigo, you mentioned infant colic, which is really one of those disorders related to gut-brain axis. And traditionally, infant colic has been seen as a self-limited condition, and it's considered to be benign. However, we know that it causes a lot of frustration to parents or caregivers. Are there any long-term impacts of infant colic with this very pediatric condition?
Apparently, yes. Several studies display an association between infant colic and the onset of other functional gastrointestinal disorders or gut-brain interaction disorders years later, probably related to the presence of common etiopathogenic factors like environmental, dietary, intestinal dysmotility, visceral hypersensitivity, and also with other diseases like allergic disease. It's not clear about the relation between infant colic and allergic diseases. There seems to be a relationship between infant colic and subsequent, by example, migraine, headaches, other behavioral problems in children with a history of infant colic appear to be associated with higher parental stress scores. However, the current evidence is based on associations and currently causal relationship between excessive crying and infant colic and long-term consequence remains not well documented.
I mean, it's extremely important, and I think we repeated already on a number of occasions that we are talking about associations, not only when it comes to infant colic, but also other of those diseases, and that causation has not been documented. But let's discuss infantile colic in more details. What are the factors which are influencing the microbiome that can cause, well, I'm using the word dysbiosis, and it was also the term which was used by you, but you know that in the literature there is a lot of discussion that this is not the proper term to use because we don't know what is a normal microbiota. But let's say all these alterations in the gut microbiota. So what factors are influencing the microbiome that can cause this alteration and precipitate symptoms of infantile colic or other disorders?
As you mentioned, it's very difficult to establish definition of dysbiosis, and the pathogenesis of infant colic remains unclear. We have to state this, but it's thought to be multifactorial. However, a growing body of evidence suggests that the gut microbiome contributes to the development of this condition. So all the factors that affect the gut microbiome could be one of the factors affecting the pathogenesis of infant colic. Colonization is influenced by a number of external factors like maternal microbiota, maternal health status, prenatal maternal stress, maternal medication use.
Not only, especially antibiotics used by mothers during prenatal period, but also exactly. So
but also important. Environmental factors at home, at the hospital, the use of antibiotics in the infant, mode of delivery, and infant feeding mode. However, there are no indications that these factors, at least separately, are associated with the development of the infant colic. So it's more difficult than say that the use of antibiotics and the use of that are directly related to the infant colic.
But those factors, as you said, they definitely have an impact on gut microbiota.
Yes.
And again, we are speaking about also other diseases like allergy, obesity, etc., cesarean section, or the use of antibiotics that we mentioned so many times. They really have an impact on gut microbiota. And diet, extremely strong modulator of gut microbiota. And in children, we do promote breastfeeding, and it's really important to remember that breastfeeding contributes to this proper colonization of the gut microbiota. Well, we are just coming to the modulation of the gut microbiota because there are various ways we can modulate the gut microbiota. So what are these methods that we can modulate the gut microbiota? And probably we can discuss in the context of infant colic because it's always the best things to discuss based on practicalities.
I think we have evidence of untargeted microbiome-directed interventions, basically in lifestyle factors, and some evidence of the new world or relative new world of biotics. No, mainly in the field of probiotics is one of the most studied, but we have to remember that we have prebiotics, probiotics, postbiotics, and symbiotics. So we have little evidence about the efficacy, but I think it's a promising evidence, no? But we need more and more studies around this field.
But going back to infant colic, I mean, you know that my scientific heart belongs to ESPGHAN, European Society for Pediatric Gastroenterology, Hepatology and Nutrition, and we publish these guidelines on the use of probiotics in gastrointestinal disorders. And infant colic is one of those disorders that we do recommend at least 2 strains, and I know that you know the strains that we do recommend. So perhaps it's also an option to present them here during this podcast.
Yes, we need to remember that there are different quality guidelines, but one of the most used around the world are from ESPGHAN. So ESPGHAN guidelines suggest or recommend the use of one strain. We need to remember that when we prescribe or recommend a probiotic, should be based on the strain, strain specificity, and that is important. They recommend Limousin Lactobacillus reuteri, DSM 17938, and we need to remember all the names.
The name and the letters and the number is important.
Yes, there are several Limousin Lactobacillus reuteri in the market. So we can use this or recommend this strain for the management of infant colic in breastfed infant with a certainty, this is important, with a certainty of evidence moderate and a grade of recommendation weak. There are growing evidence of other strains, but they can't be recommended as a first option.
In our guidelines, you also do recommend, in ESPGHAN guidelines, you also recommend Bifidobacterium bifidum BB12 as another one. Yeah, and then the question is, and people are often asking what you can expect when you are using these probiotics with documented efficacy. And we know that it's a reduction in the crying time, about, let's say, half an hour or something like that, which I always keep saying that it really makes a difference. I mean, maybe not here when we are talking, when we're discussing it here, but for parents at night, it really can make a difference. Excellent. And this is just like one of the examples, like we can use modify gut microbiota in these gut-brain disorders. So something that definitely to be evaluated further. Thank you very much, Rodrigo, for sharing your insights and your expertise. And let me summarize by saying that our gut and brain are really in constant communication through this very sophisticated signaling system. And without a doubt, microbiota play an important role. And it has been a pleasure for me discussing this relationship between gut microbiota and the gut-brain axis and its implication in various disorders, with the example of infant colic. So I thank you, Rodrigo, very much again, and I thank our listeners for joining us today. So stay tuned for more discussions on the latest in health and nutrition research, because a lot is ongoing. Thanks a lot. Thank you very much again, Rodrigo.
Thank you, Anya. Thank you.
And that concludes today's episode. Thank you for joining us with Hania Shayevska and Rodrigo Vazquez as we talked about gut microbiota and disorders of gut-brain interaction. We hope you enjoyed and learned from this quick discussion, fellow experts. Till the next episode,